Hi everyone, thank you for joining us here today. We are Ovee, I'm Courtney, and this is Jane, and we're really excited to share our work with you today. First, we'd like to introduce you to our friend Yumeng. So she is a 22-year-old full-time student. She's originally from China. Currently, she is experiencing some issues with her reproductive health, but she's really uncomfortable talking to strangers, and she just is avoiding going to the gynecologist at all costs. So we're going to learn a little bit more about her.
There's something going on down there, but I don't know what's wrong. Google tells me I'm dying, or worse, pregnant. I know I should see a doctor, but my friends say it's terrible and uncomfortable. It's hard to know what to expect. I wish there was a way to prepare.
Introducing Ovee. Ovee is an application that is designed for young women to take control of their sexual and reproductive health. Ovee creates a safe space to ask questions and alleviate anxiety. It allows women to learn about their bodies in a private setting. She's ready for her appointment. Are you? Ovee, what to expect when you're not expecting.
So you all might be thinking that this is a very isolated case and it's just Yumeng, but this actually is a problem with a lot of women. So when we were doing our research, we found out that only 15% of annual checkup visits from the last census were women aged 15 to 24. And it's very important for young women to get into the routine of preventive care because it can stop issues from escalating. So in the year 2017, there will be about 13,000 cases of invasive cervical cancer. Women at this age range are at the highest risk for STI infection. And over our lifetimes, 80% of women will have some sort of HPV infection. So it's really important that we're catching these issues early so that they don't escalate into bigger issues.
So there's a huge market for preventive health care. About $27.5 billion is spent on these services. But women aren't taking advantage of what's available to them. And we were curious as to why that was happening. So we took some time and discussed sexual and reproductive health with several young women. We had the opportunity to collect data from about 60 women, and of those women, 100% of them were sexually active, but only 30% of them were actively using contraception. And oftentimes this was because they maybe didn't know what their options were, or they're just afraid of going to the gynecologist. And that fear is completely understandable. A lot of the information that's out there is either really intimidating or can be frightening. And while insurance companies do cover these services, the preventive services, there's a lack of support and outreach, particularly for young women. There are programs that help with this, such as Planned Parenthood, and applications that focus mainly on either period tracking or pregnancy, but there really isn't anything that makes preventive health more personal for young women. And so this is where Ovee would fit in. What if there was something that combined that information from Planned Parenthood with the appeal of Snapchat and the intelligence of Watson?
So Ovee is our application that we've designed specifically for women and their unique healthcare needs. So we're encouraging women to take agency over their health. So we're leveraging two new interface technologies, artificial intelligence and augmented reality, to increase that engagement. So for the artificial intelligence, what we're doing is we're giving women with a pre-visit tool so that they can feel comfortable interacting with a virtual gynecologist. So in this safe virtual space, they're able to ask and answer questions, and then eventually this will alleviate their anxiety, forming a bridge to a real doctor. So not only is this a safe space for women to talk to a doctor, but we're also collecting a lot of data. So we're collecting data on what women are curious about, what types of questions they're asking, and then the more women that interact with this, the smarter the system will get. We're also leveraging augmented reality as a post-visit tool. So with augmented reality, women will be more engaged with the content. And also the card that doctors will hand out to patients is very private. It looks like a little illustration, so women can feel comfortable taking this with them. So you don't have that awkward experience of having I have chlamydia brochure on the train. You can put it in your bag and it's not embarrassing. It's very discreet and private. And for healthcare providers, this is a lot easier for them to update content. So instead of having to reprint brochures, they can just update the content and the women will already have their little scanning card.
Our goal is to partner with different insurance companies or larger health institutions so that they can provide this support for their younger patients or clients. We had the opportunity to speak with several insurance executives, and they expressed interest in increasing member engagement, particularly around preventive care. And over the last few years, health insurance companies have been more willing to spend money on these preventive services because it'll save them money in the long run. So right now, we're focused on building these relationships with healthcare providers, including insurance companies, pharmaceutical companies, or hospitals. In the next 6 months, the goal is to continue to develop our machine learning system, work on the augmented reality, and further develop the back end of our application. In a year, the hope is to have our first beta test and to continue searching for funding. And with all of this in mind, our main focus is on helping young women like Yumong. She was able to go to the gynecologist, and now her new IUD is 99% effective against pregnancy, and the vaccine that she received is 97% effective against certain types of HPV that can cause cervical disease. She also got tested for STIs, and now she has peace of mind. So we are Ovee, and as a team of user-centered designers and former scientists, we are searching for ways to create things that will help people talk about really uncomfortable situations. And our main focus and mission is to empower young women to have agency over their health. Thank you.
Thank you.